placement of an esophagostomy feeding tube, you will need the following materials: surgical gloves, feeding tube, preferably an open-ended tube with additional holes along the side to facilitate food and water delivery, sterile lubricant, curved carmalt, forceps, needle holder, scissors, blade and blade handle, non-absorbable suture with cutting needle, mouth gag, bandage material, optional kitty collar, antibiotic ointment, Christmas tree, fluted end, feeding end, tube tip, and a feeding tip syringe. Your patient will need to be anesthetized using either inhalant or injectable anesthetic. Place your anesthetized patient in right lateral recumbency. The area over the mid-esophagus will need to be clipped. Landmarks for clipping are identified as the base of the jaw to the point of the shoulder. Once the hair is removed, finish the site preparation using a sterile scrub technique. Next, pre-measure the feeding tube. Place the tube tip at the last rib and measure to the site of insertion, which will be the mid-esophagus. Determine the length and mark it with a waterproof marker or tape. The mark is measured from the tip of the tube. This will be your indicator of how far to introduce the tube down the esophagus to ensure the tip sits in the distal esophagus and not the stomach. Now you are ready for placement of the feeding tube. First place the mouth gag, then gently introduce the carmalt into the oral cavity and down into the mid-esophagus. Angle the carmalt so the tip is pointing upwards and is palpable through the skin. Ensure the carmalt is free of the jugular vein. It may be helpful to identify the jugular vein with a marker. Open the carmalt tip slightly. As the open carmalt tip is pushed upward, make an incision through the skin into the lumen of the esophagus, using the open tip as a guide to position your blade. Close the carmalt tip and gently push it through the incision to the outside of the skin surface. Reopen the carmalt tip and grab the tube tip in the carmalt. Gently retract the tube back through the incision and out through the mouth. Apply lubricant to the exposed tube. Fold the tube back on itself and direct it back down the esophagus. You may need to use the carmalt to help push the tube if the oral cavity is a small opening. As you direct the tube down the esophageal lumen, slowly pull upwards on the opposite end of the tube, which is outside the incision. This will facilitate the tube to flip and redirect itself for the correct positioning in the distal esophagus. Once the tube is introduced to your preset mark, you will need to secure the tube in place. To secure the tube, you can either place an anchor suture through the skin and around the tube, or place a purse string suture that encompasses the tube at the site of insertion. Here we will demonstrate the placement of a purse string suture. As you anchor the feeding tube, be sure to adjust the suture as to have 2 equal lengths of suture material. Once the surgical knots are set for your anchor, proceed with a Chinese finger trap or modified finger trap suture approximately 1 to 2 inches up the feeding tube from the anchor spot. This will help ensure the tube will stay securely in place. Next, you will check tube placement. Attach a syringe to the end of the tube and aspirate back. If you get negative pressure, the tube is correctly placed. If you get air back into the syringe, then the tube has been improperly placed. Alternatively, you can take a lateral radiograph of the thorax to confirm the tube is correctly located in the distal esophagus. Once you are certain of proper placement, the next step is to determine the length of the tube to remain outside the insertion site. A tube too short may result in feeding or bandage change complications. An excessively long tube may result in excessive flush volumes or become bothersome to the pet. Once an appropriate length is determined, cut the excess tube and securely place a fluted end or feeding end tip on the end of the tube. The last step is to place a bandage or wrap around the neck. Start by applying a betadine or triple antibiotic ointment on a small square or round of sterile gauze. Position the gauze on the skin surface around the insertion site. Then wrap the neck circumferentially with bandage material. The final overlying neck wrap material may be vet wrap. Alternatively, you may use a kitty collar over the bandage wrap layer. These commercially available collars have a pre-cut hole for the feeding tube and secure around the neck with a sturdy Velcro closure, allowing easy neck bandage changes. Finally, tape or Velcro the end of the feeding tube to the outside of the neck bandage. Based on your assessment of the pet's behavior, you may choose to place an Elizabethan collar on the pet and trim the nails to prevent them from scratching or pulling at the feeding tube.